Hi, I'm Rigby, a personal trainer and corrective exercise practitioner at Inspire Fitness for Wellbeing. Today we're going to examine and look at tightness in your hip flexor and how you may be able to identify whether you have tightness in your hip flexor and what the common causes are for this common muscular area of tightness. So I'm going to bring one of my colleagues in, Rory, to show you a test that we use. So Rory, can I get you to just sit down for me? Now, in life, as we talked about many times, that people's posture is changed because of the day-to-day environments that we move and we live in. Unfortunately, one of the common positions that we hold in life is sitting at a desk and sitting in cars, sitting in couches, sitting in cafes, whatever the case may be. Unfortunately, one of the areas which tightens up, or one of the muscular areas that tightens up as a result of this of constant sitting, is what we call our hip flexors, which are the muscles which attach through the front of the hip. You can see in this sitting position that those muscles are kept in a shortened position, and often we're sitting at your desk for more than 1, 2, 3, 4 hours at a time. The brain keeps that muscle in a shortened position, and that area starts to tighten up. So Rory, can I get you to come onto the bench for me? So when you're doing a test for hip flexor tightness, you ask I'll get you to lie down. So you ask your patient or your client to lie down, and I'm going to get you to bring one knee up into your chest, and I'm going to get you to slide your hip down towards the end of the bench for me. So, yep, all the way to the edge. Good, hold on to the chest and just slide a little bit further down for me. Wonderful. Okay, so pull your knee all the way into the chest. So we use at Inspire Fitness, we use a stretching or a massage bench for this. Now I'm going to just apply a little bit of pressure down of the knee down into the chest. You'll notice as I do that the line of this knee is well above the line of the table, okay, which is a positive test for hip flexor tightness. What that's indicating is that the muscle through the front of the hip here, which is our hip flexor, which attaches to the front of your spine, or to the front of his spine, is held in a shortened position, in a tightened position. So I'm just going to apply a little bit of pressure here. So we're going to do just a little bit of release here. So first of all, this is a test that we use for hip flexor tightness. We also use that as a stretch to try and release that muscle, and I'll tell you why that's so important in a moment. So I'm just going to apply a little bit of pressure down onto your knee, Rory. How are you going now?
That's enough.
That's enough? Okay. So just push a little bit of pressure up into my hand. So I'm just asking him to apply about 10-15% of pressure up into my hand. Keep going. So it's not a maximum contraction. And relax there. Take a deep breath in. And as you exhale, I want you to drop your knee down towards the floor. And you'll see the knee just starting to drop down towards the floor. Now you'll see this from an angle where we've got his knee about level with his hip. Okay, so we're approaching, I guess, what we would call a normal level. So what we're looking for in terms of this particular test is a neutral level where the knee is in line with the hip would be a neutral level. When the knee is above the line of that hip, it's a negative. So it means that that muscle is too tight. Ideally, what we're looking for is again for that knee to be below the line of the bench, or below the line of the hip. Secondary to that, this test also enables us to reveal tightness through his quadriceps. So you see that the ankle is well forward of the line of the neck. So again, that's a 90-degree angle, but it's opened up quite significantly. So again, his quadricep is tight. It's common that when people are tight through their hip flexors, as Rory is, they're also quite tight through their quadricep. Quadricep meaning there's 4 muscles involved with that. Same with their hip flexors, there's 2 muscles that's involved with that. Again, for use of releasing that, the way we would do that, and the test we would do, is just start to apply a little bit of pressure down onto the foot to enable the foot to be dragged under the line of the knee there. And you can see that Rory that starts to place a little bit of stretch through the quadricep. So in this line, I can apply a stretch through his hip flexor. I can also apply a stretch through his quadricep, and we do this as a partner stretch to help release that. I'm just going to not pursue that for the purposes of today's exercise, but I'm just going to release that, so just relax there. Fantastic. Now, just before we finish up, the reason that it's really important to stretch through that hip flexor is that because of its attachment, so I'll get you to stand up again, Rory. Because of the hip flexor's attachment up through the anterior, the front of the lumbar spine, when those muscles are tight, it starts to pull or drag his lumbar spine into an arch. Okay, so from a postural perspective, obviously that's an altered that puts far too much pressure down through his lumbar spine when he's standing. Importantly, when he's exercising, any alteration in that spinal shape through his lumbar spine will put undue force into the joints in that lower back. So importantly, if this is an area that you're tight in, it's really important that you release those and let that muscle go before starting or embarking on an exercise program. Thanks for listening, and we'll chat with you soon.